Explanation, well, this is streptovirus. What is antibiotic susceptibility?
To make sure that we are dealing with the antibiotic to kill that bacteria.
What do you mean you did? This is a very, I mean, unusual answer. What to do antibiotic? And I never say about any antibiotic susceptibility for Streptococcus viruses. You know why?
Penicillin?
We never do susceptibility for Streptococcus viruses. Why? This is the questions we will ask in the final. Because there is no reported resistance to penicillin. What other organism not reported yet to penicillin? Tribunema pallida. Tribunema pallida. This is the only two organisms still until now sensitive to penicillin. Okay, now why we use the bacillus now to differentiate group A from other groups? Why we do that? What is the reason of differentiating biogens A from others, or differential group A from others? And I remember I told you, don't memorizing organisms, diseases, diagnosis without understanding the concept behind each. Because what? What do you mean the management will be different? Yes, yeah, because group A may have a risk of causing what we call it post-streptococcal infection, right? So this is a risk for, that's why we differentiate between group A and other groups.
By the way, it is not a rheumatoid arthritis.
It's a rheumatic fever.
Rheumatic fever and post-streptococcal glomerular difference.
Yeah, post-streptococcal.
And immunologically speaking, this is also molecular mimicry, very good.
Right. Now, if we have the throat swabs, patients have clinical symptoms of upper respiratory tract infections, right? And then when we do a gram stain, you don't see anything, even if the cultures, you did not isolate anything. So what will be your diagnosis? Viral infection, if you get any sort of signs, symptoms of the upper respiratory. Why did this organism positive or the stain positive was gram stain? What makes this organism positive for gram stain?
Yeah.
What is bifidoglycan?
Speak to the microphone.
What? And I cannot hear.
Because the peptide proteins in the gram-positive bacteria and the cryptoglycan cell wall, it retains the stain. That's why we see.
It is the cross links or the whole cell wall, peptidoglycan.
Yeah.
Whole peptidoglycan.
When we say stain positive or gram stain, what color it takes? Different color. Okay.
Should we move?
Yeah.
This is the question actually in my last lecture. I'm not sure whether this was a group or different group. If you have listened to the video, this important question was posed by the students. And I was surprised that the students were asking that gram-negative bacteria, they do not have peptidoglycan. Some of the students mentioned. So now we made this question based on that misconception. Why do gram-negative bacteria not stain with gram stain in spite of the fact that they have peptidoglycan?
They will be sent, but then there will be discoloration because the crystal violence and the iron complex is not going to be like it creates
complex.
so much thick glycan. So in gram-negative bacteria, the complex will not be attached to the thin thick glycan layer, and then when you put alcohol, it will be discolored because the complex is not attached.
In that case, what will be the color of gram negative,
Yes.
which is counter-state saffron?
Yes.
Mhm.
Yeah,
So this concept is clear that peptidoglycan is present in both gram positive and gram negative, but there are some differences, thick and thin. And in gram positive, it is outermost layer, whereas in the gram negative, it is not outermost, it is covered by the outer cell membrane.
yeah, both have peptidoglycan, but the thickness, the layer of peptidoglycan in gram-positive bacteria more than gram-negative bacteria, right?
So basically, the thicker the cell wall means that it doesn't decolorize. Is that right?
Yeah.
Whereas the thinner one decolorizes, so the gram stain washes off. But if it's thicker, it's retained, so it will still keep the stain.
Right. What other organisms you don't have peptidoglycan? Huh? That's right, very good.
And what about mycobacterium? Would they still gram positive?
Why is acid fast? Because what? Mycolic acid. This is a waxy layer in TB. And when you do acid fast, you need to heat. You remember in the lab? Why we heat? To enforce, the dye get into the cell of the mycolic.
Why is it called acid fast? Why is it fast? What does that refer to?
Because the oxygen will protect the skin from being washed out of that.
Yeah, but just bear in mind, in English we say something is stuck fast. That means it's stuck very strongly. So don't think of it as washing out very fast.
What about fast food?
Well, that's Americans. They came up with it. They corrupted the language.
Okay. Okay, he was started empirically, we discussed already that up to now, assuming that this is Streptococcus pyogenes, so penicillin is a good drug, isn't it? So did we do right? Amoxicillin? Good.
Right. What do you understand from empirical treatment?
Very good.
Huh? Based on what? Based on what? This is a correct way to treat patient empirically?
Based on the assumption that there's no resistance yet. So before you know what the bacterium is, you know that penicillin is a broad spectrum antibiotic. So you check for any allergic reactions first, and if you start to first on it, while you check for the last results.
Right, but you don't bother about hypersensitivity or
You check for it first to see if there's any allergic issues in the skin type.
what type of hypersensitivity is that? Type what? يا راجل حرام عليك. فين طيب؟
Hypersensitivity, allergic reactions, allergic or IG mediated.
طيب فضة هتضيعه ده كده.
IG mediated is type 2.
Which type? In what is in me? أنا I hate answering what يعني you may make a mistakes in the name of the organism. If you tell me, for example, Crinibacterium aureus, I will accept it, but not innate. What is innate here? I'm not talking about innate. You know what is innate? What is innate? What type of hypersensitivity? Garwin will address that to you.
Yeah, you're right. Type 2.
So that is hemolysis. We are talking about allergic reactions. Skin rashes, anaphylaxis, are the is this, type 2? IgE mediated, immunoglobulin E mediated.
Well,
Although-
it's a bit of an unfair question because penicillin
Can cause any type of, any type of, yes.
can be 1, 2, 3, or 4. But basically, you're right that in hemolysis,
Hemolysis is type 2.
type 2.
Yes.
But it could be,
Allergic reactions, when we call allergic reactions, that is type 1 are these. Okay? Skin rashes, anaphylaxis, those are IgE material, those are type 1. But hemolysis, type 2, it can also cause a serum sickness like type 3, and it is also sometimes delayed sense cell mediated with type 4. So theoretically, all 4 types of hypersensitivity reactions are possible with penicillins, but the most common one is allergic reaction, which is type 1,
Type 1.
IgE mediated. Okay? Okay. So amoxicillin is right. Okay? How would amoxicillin benefit this patient? Use them, please, boys, from backbenches. How would amoxicillin benefit this patient whom we assumed is suffering from an infection caused by Streptococcus pyogenes? Yes. Routine.
Slow down the bacteria so it will slow down the growing bacteria.
Is a penicillin cell synthesis inhibitor? You said protein synthesis inhibitor, didn't you? So, do you find the difference between cell wall synthesis? Cell wall synthesis inhibitor. Okay.
It is a, what type of effect is it? Is it sided or static? Why sided? Because at one cell wall. What is the definition of static drug?
Faria, can you confirm? Are they
So the students who are online are not able to hear the students who are speaking here, because they're so far from the mic.
okay?
So I'm thinking maybe I can put them on conference.
But we are asking the question, they can participate anytime if they want, just speak out.
So they are participating over chat, but what I mean is they can't hear the answer that
They cannot hear the answer.
Okay.
Are some of you online? Great, so maybe some of you can, turn on, wait, what do you have to tell us? So it will cover column is there. So if you're disinformed, for example, if someone else